Hi, everyone. Thanks for joining us. We are going to wait a few more minutes, let more people join. Okay, I think we're good to get started. Hi, everyone, and welcome to the June Hawaii Public Health Training Hui webinar. This is called PTSD and Trauma, the Impact of Individuals, Providers, and the Community. My name is Melia Schneck, and I will be your facilitator for today's training. Before we get started, I just want to go over a few Zoom housekeeping rules. I first want to thank the organizers of today's training, Makamai Namahoe, who is currently in Minneapolis right now, but she is joining us in spirit. We also want to thank our Public Health Training Hui Steering Committee for helping us organize today's training. These are our sponsors and partners who have provided today's credits. We have the National Association of Social Workers, the Hawaii chapter, the Western Region Public Health Training Center, as well as Joint Accreditation and the Public Health Learning Network. For today's training, we are offering the following credits: Certified Health Education Specialists, or CHES, Registered Dietitians, Licensed Social Workers, as well as Certified Nursing and Certified Medical. We are approved for 1.5 credit hours for today's training. If you would like to receive CE credits from this training, we ask that you please complete the survey that will follow today's webinar. I will be emailing everyone who attended today's training with the email address that you used to register for today. So please keep an eye out for that email. If you are joining us by telephone, please send me an email with your name and your phone number that you use so I can make sure that you receive your survey. My email address is melia@hifi.org. That's melia@hiphi.org. If you don't receive an email from me by today, please feel free to reach out. Sometimes we run into problems because organizations' firewalls will block outside emails. So if possible, please reach out with a personal email address instead. We ask that you complete your survey by next week, Wednesday, June 18th. If you've completed the survey, you can expect to receive your certificate by July 1st. If you don't receive your certificate by then, please feel free to contact me at melia@hifi.org. Some brief housekeeping. All participants are muted upon entry with their cameras off. Please ask your questions in the chat or in the Q&A box below. I will be monitoring the chat and collecting questions to give to our speaker. This webinar is being recorded and will be uploaded to the Public Health Training Hui's YouTube channel afterwards. You will be sent a link to that in our Mahalo emails. Lastly, I'd like to introduce our guest speaker today. Mestiza Sigas is the Program Director for Mental Health America of Hawaii. Her education and experience has been focused on diverse populations, including inpatient acute adolescent care, community mental health, and military mental health. She is a member of the Mental Health Task Force, the statewide and Oahu Suicide Prevention Task Force, and a board member for the Waipahu Aloha Clubhouse. She has been working in Hawaii since 2006, being originally from a small farming community in the Appalachian Mountains. She is passionate about bringing education, support, and resources to rural communities, like those in which she spent her childhood. Okay, that's it for me. I will now pass it on to Mestiza.
Well, hi everyone. I'm going to go ahead and share my slides, but I'd love seeing all um, hellos, especially those people from the South coming in saying hi. I love that. But today we're basically going to be talking about just a general overview. The reality is we could talk about PTSD and trauma for months, if not years. It's such an in-depth topic. So today we're just going to do kind of a brief overview talking about PTSD and trauma, its impact on individuals, providers, and the community. We're going to look at the different types of trauma that can be experienced and how it affects the individual, as well as really specifically the negative impacts that it can have. We will spend a few minutes talking about vicarious traumatization because for those of you who are doing the work and providing the care as healers, it can be something we have to keep an eye on. We're going to talk about common treatments. I definitely have some of my favorites, but throughout the presentation, because it can be such a heavy topic, what we're going to do, which is a little bit different, is we're actually going to take a skills break. And so when we talk about those coping skills that are specific to high levels of anxiety and PTSD, those skills breaks are going to be skills that you can use for yourself or for your clients or your patients who are also experiencing anxiety and PTSD. These are typically ones that I have used with my patients who've had a diagnosis of post-traumatic stress disorder or who are coming in patient care and needing some more skills. So they're really great ones. If you have ones that you enjoy using, please feel free to drop those into the chat as well. And then we'll talk a little bit about some of the community crisis resources that we have. The first thing I kind of wanted to talk to you about was, of course, mental health. It is really getting an idea of what that mental health spectrum looks like. And the reason I think this is really helpful is because when we talk about trauma, when we talk about post-traumatic stress disorder, you'll hear people talk about it with different terms. So, for example, if you are doing cognitive processing therapy, you might hear subjective units of distress. So the languaging can be a little bit different depending upon what the frame is. But for our purposes today, what we're going to look at is general spectrum. And when we look at this, I think it's just such an easy visual to understand why we can move along that spectrum in a lot of different ways and how to be aware of self-assessing ourselves and what we might need as we move back and forth. So we'll start on that kind of right side, which is excelling. We all love to be there. And the reality is we're not there all the time. I actually think it's probably a little bit unrealistic and also unhealthy to try to push ourselves into a place of excelling all the time. We definitely also need rest and rejuvenation. But when we're in an excelling place, it's definitely a place of growth, of cheerfulness and joy. We're at a high performance. We get to spend time in our flow, which is a place of mastery where we lose time because we are so involved in something that we enjoy. And what's really the place of full potential with a little bit of stress, we're still thriving, but we're still calm, we're still performing, just not the highest peak. We're sleeping well and doing our basic day-to-days. Now, as that stress starts to move up, we might start to find ourselves more in kind of survival mode. So we're feeling that worry, we're maybe nervous or irritable or sad. We're going to have a little bit of disruption in things like sleeping and eating. Our attention and concentration won't be perfect. And we're going to start to feel like it's hard to manage being social. It's hard to manage doing that on top of everything else. So we might start to withdraw. Now, as it goes up to about the moderate level, moderate to high, you might find that you're struggling. So here might be a place that you're saying, I feel anxious or depressed. My work or my school is definitely starting to be negatively affected. I'm not sleeping well. I'm not able to kind of eat consistently or eating too much for comfort. And when we get to a place of crisis, this can definitely be a response to trauma. But this is where we start to say, I'm having a significant negative impact to my day, to myself as a person. I'm very anxious. My mood is really low. It's just really hard to motivate myself. I'm missing doctor's appointments. I'm missing going to work or events that I really wanted to go to. I'm exhausted. So you heard the mention that I'm from the South. So we have really interesting sayings there. And one of them is I'm bone tired. Like I'm just so tired of seeing the bones. And I think that that is something you'll hear people say when they're kind of in crisis mode, despite maybe taking a day off work, despite maybe having a nap. I'm just exhausted all the time. Fatigue is a big hallmark there. Again, sleep will be disrupted. And you might have people who have weight loss, but even for some, it could be weight gain. Again, that's that comfort eating to find kind of a place of getting a little bit more support, but in kind of negative coping ways. The reason we want to point this out is because I think we do a lot of talk about how to move towards excelling, how to move up in that range. But the reality is for a lot of people, they are starting to struggle. They are finding themselves in crisis. And so today we're going to talk a little bit about what that looks like and what could be helpful there. So big breath. That's going to give us a really nice umbrella for as we move to talk about those things. But the first skills break I wanted to do with you is my favorite skill, and that is the dive response. So when we are at a high level of stress, when our bodies are reacting because the nervous system is activated, Sometimes people will say, let's talk about what's happening. Let's sit down and let's come up with an idea. Let's do pros and cons. But the reality of it is, when your nervous system is activated, the brain doesn't function the same, and that's not as helpful. The number one thing that we can do is actually to calm the nervous system first. So the dive response is exactly what it sounds like. Your body is responding to diving. Everyone has a gland on the side of their nose. It's right here. And when you dive, what it does is it activates. As soon as cold water hits that spot, it activates. It wants to save you from taking an involuntary breath. And so it's going to hold on to the oxygen in your system by slowing down your blood pressure and slowing down your heart rate. The intrinsic oxygen is actually in your blood. And to conserve it, it will slow it down. Now, when it slows those things down, that actually feels like relaxation to our bodies. And your brain will say, oh, we're relaxing, and it will assist in that. The dive response is a very physical way to short circuit your nervous system activating. So what can you do? Go for a swim. You live in an amazing place with beautiful places to swim, but you're probably thinking, I can't go swim every time I'm really stressed. That's fair. But we can also do is submerge this portion of our face into a bowl of cold water and hold our breath for a few seconds. It will also activate. And then for those of us who are like, I don't think I can do that either. If you take a cold, damp, wet rag, place it again across this portion of your face and hold your breath for a few seconds, it will also activate. Not as strongly, but it will activate. It's a really beautiful way to activate a body's relaxation system without having to talk about it first. We use this in our inpatient units quite frequently, and people really found it effective. So if this is something that you think would be helpful for yourself, that's fantastic. And if it's something that you would like to share with your clients, that's also great. The dive response is just such a wonderful skill to have in your pocket to use when you need it, when people are at that high level of dysregulation. So let's talk a little bit about trauma, because that's kind of why we're here today. And the reality is, like I said, we could spend months talking about trauma and still just scratching the surface. But when we talk about it, there's a lot of different language that gets kind of shared and misunderstood a little bit. And so you might have people talk about it in different ways. Some of those times they talk about trauma in terms of, is it a big T or little t? Now, big T tends to be something that's very large with a really big impact that could even be like collective or community wide. So a natural disaster would be an example of a big T trauma. A little T trauma is tends to be kind of thought of as something a little bit smaller that's really affecting probably just most of you. So you see in the types of trauma, life transition could be an example of this, that you're having a significant life transition. It might be acute in nature and very short term. And so someone might term that a little bit more little T trauma. And that brings us into that middle range of people talking about the different types of traumas. It could be life transitions. Vicarious trauma we'll talk about in a few minutes. And it's the idea that when you do the work, when you're a provider and a healer, that people sharing those stories with you can have an impact, and you can carry those stories home with us despite not wanting to do so. Complex trauma is having multiple types of traumas that sit in a person's life. Historical trauma, that it's happened in a community. I remember working in a community where they had been involved in research, but it wasn't very clear how that research was going to be used. And they really felt disenfranchised by how that was done. And there was historical trauma about trust for providers. So it's important to understand those types of things that can exist because of how things are used. It could also be intergenerational trauma within a family system, collective or community, and also acute, which brings us into time frame. Some people refer to acute as something that is short term, where chronic can definitely be more long term, and complex again could be repeated. So this is all the types of languaging that can be used around trauma and how people discuss it. The other thing to think about is people star. The other thing to think about is how we respond. So you've already heard me talking about that nervous system, which does a wonderful job. But I think it's important to note that when decisions are made as to how the body will respond, they're done mostly unconsciously and instantaneously. So when people have things like guilt or shame or blame about how they responded to a trauma, it's important to note the body decided very, very quickly what was the best route for survival. So it's going to look at a perceived threat and it's going to ask itself a couple of questions. And again, this is happening very quickly. It's going to ask, can I escape? Can I overpower it? Can I make it lose interest? And that's where it starts to decide between running, fighting, or freezing. Now, you'll see a little bit more now in the literature this idea of collapse. So we're going to kind of talk about how that is part of the same point as freeze, just a different side. So that response really is sitting on the opposite side of freeze. And so let's talk about those two types. Freezing is where I'm priming to respond once the threat has passed. And so my eyes are wide, I'm taking in all the sensory information, my muscles are tensed up, my heart rate's up, my blood pressure's up, but I'm not responding yet. I'm waiting until the threat passes. That's what my brain and nervous system has decided for me. So a client who's having this might say, I feel stuck, I can't move, but they're taking in all the information. They are almost over responding. Now, the other side of that coin is kind of an under response where the muscles are actually soft. The parasympathetic is more dominant. So the heart rate, the blood pressure, the temperatures, they are actually lower. This is someone who's probably not talking about how they're feeling. And they're having a blank stare. Instead of an eyes wide open, it's a little bit more of a detached stare. And they're not getting in sensory information. What the brain has determined is it's safer for them to not be as present and grounded in the body. And so it's going to release some chemicals, start numbing out what it perceives as a possibility for pain. And this could even result in someone becoming unconscious or fainting. So you can see why it's really preparing the body for what it perceives as the threat, but it's trying to figure out, can you get lose interest first? And again, it's important to understand this because when we encounter these kind of traumatic events, how we respond is sometimes outside of our control. If you've been trained to know that that was a possibility and know how to respond, then you will. But sometimes these things are outside of our awareness, outside of our training. And so we respond the best way that we can, but it's on a very unconscious level. To kind of make things even more complicated is how the brain becomes affected. So trauma can also affect our memories. And this is just a very quick snapshot of what that can look like. Semantic memory is just fund of knowledge. So in that example that they have here, like what is a bicycle? That would be an example of your semantic memory. So trauma can in fact impact the ability to get that information and to kind of combine it all. Episodic can very much be affected by trauma. This is autobiographical. It's the day-to-day kind of sequence of events, the who, what, when, where of the event. What happened to me? So because trauma affects it, we might not have all the pieces. You'll hear people say, I remember this part and this part, but there's a gap in between. And so it makes it very difficult to be able to heal when we don't have all the information. The emotional memory that gets affected is I might recognize that I have these feelings, but I don't recognize why they keep coming up. I don't know why I feel overwhelmed. I don't know why those same memories or emotional memories are coming up, but not connected to the traumatic event, but connected to this instead. And without context, again, it makes it quite difficult. Procedural memory is the idea that we're doing something, like the procedure of something, performing a task. Even that can be impacted because, for example, with the bicycle, if I know how to ride a bicycle, but I've had a traumatic event with it, riding it, then I might become tense and nervous when I'm actually on the bicycle, which changes my posture, which actually makes it more difficult to ride the bike. So while we simplify that example to better understand trauma and memory, when you start to look at it at a larger scale of all the ways it could be affecting us, memory is a big one that we have to talk about because it's hard to heal from what you don't remember or what you've used context for. So another skills break. Paced breathing. You've heard me talking about effectiveness. effectiveness of calming the nervous system and regulating the body. And breathing is one of those underrated things that works really well. The reason it works, we won't go too deep into it, but the reason it does work is that when I over oxygenate the body by breathing really deep, what it does is it gets interpreted by the brain as we must be calm. Because look how deep we're breathing, how regulated it is. Instead of being short and shallow, it's deep and elongated. So what I want you to do with me is just practice pace breathing for a few minutes. Get in a comfortable seated position. And when you take your breath in, it doesn't matter the pattern, but for today's practice, we're going to do 4, hold for 4, 4, hold for 4. So as we prepare, what we're going to do is breathe in through our nose for 4 counts. Then we're going to hold that breath for 4 counts. And I want you to exhale through your mouth for those 4 counts, and then hold that for 4 counts. So in for 4, hold for 4, out for 4, hold for 4. Ready? Inhale 1, 2, 3, 4. Hold it 1, 2, 3, 4. Exhale 1, 2, 3, 4. Hold for 1, 2, 3, 4. Let's try it one more time. Inhale 1, hold. Exhale, hold. Awesome. Breathing is a great tool to have because all you need to be able to do it is time. And I think that any skill that we share, that's a really important thing to keep in mind, accessibility. So I try to explain a little bit about why breathing is helpful because when I introduced it to my team's group, I can't count how many people said, yeah, I know how to breathe. But when I explained why it works, how to do it correctly, pulling from the diaphragm, finding a pattern that works for you, making it a little bit difficult so that they could practice different patterns. That's when there was a little bit more buying in and understanding of, yes, I can feel how that shifts in my body. We are talking about trauma and the impact on individuals. And I think that when you have that conversation, you can't have it without talking about the ACEs study. The ACEs study is such a foundational study of understanding trauma in childhood and its long-term impact on an individual. We're going to watch a video that discusses the ACEs study and kind of what it was looking at. But I would suggest that you note for yourself as you're listening to the video, who was in the sample group? What protective factors did they have? So again, listening for sample group and protective factors.
What does your parents' divorce have to do with your risk for heart disease? If your mother had a drinking problem when you were growing up, are you more likely to suffer from depression as an adult? Here's what you should know about ACEs. ACEs stand for Adverse Childhood Experiences, extremely stressful events that can happen to a child growing up. Some experiences are so stressful that they can alter brain development, as well as the immune system, increasing the risk of lifelong health and social problems in adulthood. The term comes from the Adverse Childhood Experiences Study, landmark research that shed new light on the root cause of everything from stroke and liver disease to substance abuse and mental illness. In the late 1990s, an epidemiologist from the Centers for Disease Control and a preventive medicine doctor at Kaiser Permanente set out to understand the association between childhood experience and lifelong health. They asked over 17,000 people in the Kaiser Health Plan in San Diego about their health history, as well as difficult questions about their experiences growing up. Anda and Felitti tallied up 10 different kinds of adversity in this largely middle-class and college-educated population. They were stunned to see how common ACEs were. 21% of all respondents were sexually abused as children. 19% grew up with someone who suffered mental illness. 28% had been physically abused. And 2 out of 3 respondents had experienced at least one ACE. The researchers next looked at how someone's ACE score, or the number of adversities they experienced, related to a wide array of serious health and social problems. They saw that the more ACEs someone had, the greater their risk for poor outcomes compared with someone with no ACEs. Someone with an ACE score of 4 had twice the risk of heart disease and cancer. Someone with an ACE score of 5 had an 8 times greater chance of being an alcoholic. And those with an ACE score of 6 or more, on average, died 20 years earlier. With every major problem they looked at in the ACE study, the risk went up for each additional adverse experience in childhood. As Dr. Robert Anda says, what's predictable is preventable. It's important to remember that ACEs are not destiny. ACEs are a tool for understanding the health of a population as a whole. For individuals, an ACE score can be a tool for understanding their own risk for health and social problems, and empower them to make changes for themselves and their children. ACEs tend to get passed down from generation to generation and are common across all income levels, races, and cultures. But increasingly, people of all different professions and backgrounds are coming together to discuss how ACEs affect their communities. They're finding new ways to treat and prevent ACEs. Many doctors are starting to screen their patients for ACEs as part of their medical history. More schools are becoming trauma-informed, considering the source of problem behavior when disciplining their students, instead of immediately suspending or expelling them. To learn more about interrupting the cycle of adversity and improving health and well-being for the next generation, please visit kpjrfilms.co.
So the sample group. The sample group was, if you noted, taken from San Diego, mostly middle class and largely college educated, which being middle class and largely college educated could be seen as being protective factors. And the reason I like to point that out is because you really got people talking about, is that what we're seeing? Are those the people that we're working with? Are there other places where those aren't in place, those protective factors? And then what would it look like if we started this study and did it somewhere else? And they started to do that. And we'll talk about that in just a few minutes. But what we were seeing from that study is that there was really these kind of 3 categories that they were looking at, and it was abuse, neglect, and household dysfunction. That the vast majority of people who were in that survey said that they had some type of ACE. Only 36% said there was none. And so that does leave the vast majority of people saying they had some type of adverse experience. And when we look at that information, substance abuse and physical abuse was at 28%, so the highest level, and below that was parental divorce, below that was sexual abuse. So things to consider when we're looking at people's experiences and that impact. Now, the thing that always stood out to me about this study was life expectancy. that when they started to look at people who had ACEs of 6 and above, their life expectancies were predicted to be 20 years less. And I think that's where that little slogan that they talked about, what is predictable is preventable, is so important, that people get the care that they need, they get the support that they need, because by knowing that this is possible, you're able to stay on top of your health care, of your mental health care, your physical health care, get support that you need, and really take it seriously in terms of what do I need in my life for self-care, for resiliency, for when things get stressful, because I do have this other experience that though I can't go backwards and change that, I can go forwards and support my healing through it. We talked about the fact that that was a very specific study in a very specific place. And so when the researchers decided, what if we did it somewhere else? They chose Philadelphia. So the Philadelphia ACE Project started to expand that original study and ask themselves, if we were to do this survey, if we were to look at things like inner city youth, if we looked at intergenerational trauma, what would we find? And interestingly, they found different ACEs. So when we did the expanded study, the other things that came up this time were bullying, community violence, neighborhood safety, racism, and living in foster care. That people in groups of people, communities, have very unique experiences. And so we don't really know what some of those ACEs could be. We don't really know what those impacts are. So as they continue to do these expanded studies, it's really helpful to see what different places are experiencing and what kind of supports could be needed. When we look at kind of the overall results from that original study, we saw that about 69.9% people said they had at least one ACE. And then in the Philadelphia expanded study, it was 83.2. So it is higher, but also keep in mind that sample size was 17,000 in the original study and 1,700 in the expanded study. So a lot of room to continue to learn more. So we look a little bit closer home, Hawaii. Questions about what are our keiki experiencing? What are we seeing in the state? Who is reporting and finding that they're having these adverse childhood experiences? And how can we support our community? I think this is where data can be so helpful in some ways. So the Child Abuse, Neglect, and Hawaii 2023 report is helpful in just one place. We have a lot of different places to look for this type of information. But just as an example, what we found was that the people who are reporting and confirming these traumatic events for children are legal, law enforcement, and criminal justice. That's not a surprise for us. Medical personnel, social services personnel, again, not a surprise. Then we also have things like education personnel, child daycare provider. Really high is other when we look at the more like individual reporters, and that's a community member. We also have other relatives, so that's 15%. And we started looking at overwhelmingly what is the relationship for the child who is experiencing this, what is the perpetrator's relationship, and it is the parents. And how do we take this information and figure out how to best intervene? We start to provide training opportunities and support for the people who are most likely to encounter keiki, who are being hurt, keiki who need more support. And as you saw, it's everybody. We want to make sure that everyone has an understanding of who to call, when to call, and what to look out for. We need to start to support our parents, our caregivers, and making sure that they have the resources that they need and have the education in how to be good parents. Because some of this is intergenerational learning, and to kind of break that for them and to teach healthy ways of raising keiki, of being able to get them to the next part without them having these adverse childhood experiences. So just this bit of data can help us understand where we can best support our community, where we can provide more safety for our little ones. I know when we talk about our little ones, it can be very difficult. So we're just going to take a coping skills break for a moment and talk about temperature regulation. I was recently working with an airlines we have here in the state, and they were talking about when they aren't home, when they are traveling, that one of the things they do, of course, is they get to their hotel, they take a shower or bath, and then go to sleep. And I said, that's where we want to capture more coping skills. And I said, how do you do that? So temperature regulation is a really easy way to do that. When you become stressed, when you are having the nervous system activate, it is very normal for your temperature to go up. If you're taking a shower or a bath before you're going to sleep, if you're having a really hard day, take a cold shower. It will bring your temperature back down, and that will help you regulate. If you're not having a very stressful day and you had a pretty good day, actually, you can take a warm shower or a warm bath, and it will actually release muscle tension. It will help you relax and get into a better state for falling asleep. So cool down the temperature if it's been a really hard day, challenging day. Warm up the temperature if you're trying to relax and go to sleep. It's a trick of the trade where we're just targeting one or two things. Are we trying to release muscle tension? Or are we trying to calm the nervous system? But temperature regulation is a great one to use and a great one to teach and share because, again, it just takes a little bit of time and intentionality to be able to implement that. So we're going to move into talking about post-traumatic stress disorder, and I wanted to show this really short clip that's going to give us an idea of what we see when we're talking about post-traumatic stress disorder, someone who's experienced trauma and now meets kind of that diagnostic criteria.
Post-traumatic stress disorder is a mental health condition that's triggered by either experiencing or witnessing a terrifying event. Most people who go through traumatic events have temporary difficulty adjusting and coping. If symptoms persist and interfere with your day-to-day functioning, you may have PTSD. PTSD symptoms are generally grouped into 4 types: intrusive memories, including flashbacks and nightmares; avoidance of thoughts, people, or places associated with the event; negative thoughts about yourself, others, or feeling hopeless or emotionally numb; and physical or emotional changes, like being easily startled, constantly on guard, difficulty sleeping, or irritability. PTSD symptoms can vary in intensity or occur when you come across reminders of what you went through. PTSD is treatable. If you have persistent, disturbing thoughts and feelings about a traumatic event, talk to your doctor or a mental health professional.
That was quick. So we're going to spend just a couple of minutes talking about it. When we're talking about post-traumatic disorder, it is a diagnostic criteria that must be met. And so it's really about someone who has been exposed to or witnessed or learned about through repeated exposure a threat to death, serious injury, or sexual violence. Now, when we start to talk about the learning of it, it's from someone that we're very close to, like a family member or a friend. And you hear that part about the repeated exposure to details of trauma. If you're a provider, if you support people who are going through this healing process, who've had exposure to trauma, this could be you. And so it's really important as we talk about this and move into vicarious traumatization to really keep an open mind about, is this something that's happening to me or to people that I work with, to make sure that we are doing what we need to do to also protect ourselves. But what we're looking for here is definitely intrusive symptoms. So those intrusive memories, distressing dreams, it could be flashbacks. There could be a body response to internal or external cues. We typically avoid things that we don't like, that makes us uncomfortable, that brings up those hard feelings. So we could be avoiding memories, thoughts or feelings, anything that externally reminds us of it. So places, people, things. And because all these things are happening, it does shift and change how we see the world, how we see ourselves, other people. And we could even experience, you have it, the memory loss around the detail, which we talked about earlier. We could even have feelings around blame or shame or guilt. And we could have these really persistent negative emotions about ourselves, the world, other people. So anger, guilt. Even if we try to engage in things we enjoy doing, we might not find that it brings us joy anymore. So that's anhedonia. And then we might feel ourselves detaching from other people, from different situations, and having a hard time really feeling positive emotion. We might even have a lot of reactivity. And so you've heard them talking about that irritability and anger. It can also show up as recklessness or self-destructive behavior. Being really vigilant, like hyperly vigilant about unsafe things around you. I had someone who would only go shopping at like 2 and 3 a.m. I actually had a lot of people who did this, 2 or 3 a.m. at Walmart. And they had the schematics, so they knew the shortest route to get to the pancake mix to get back out. What that's about is it's being very vigilant about what could be unsafe and how to leave and exit as quickly as possible. That wouldn't be unusual for someone who is struggling, struggling through kind of the recovery process. It could also be a really big startle to noises or someone coming up quickly behind them. Issues with concentration and sleep, of course. And we expect this around a month or more after the event. We do look for significant impairment in relationships and jobs, and it can't be part of a medical condition or substance use. And then they're going to look for a couple specifiers. And so, is there disassociation, depersonalization, where I just don't feel like I'm in my body all the time? Derealization is kind of like I'm watching a movie, I feel disconnected from the world. Or delayed expression, which is the event happened, and much later, I started to experience some of these concerns. We know that most people, 70%, will experience some type of trauma. But the world population as a whole, about 3.9% will develop post-traumatic stress disorder at some point in their lives. And of that 3.9%, 40% that are diagnosed recover within a year. And I don't think we talk about that enough, that recovery happens for 40% of people within a year's time. So with the right supports, with the right tools in place, quite a few people can move into a place of recovery, while some people need specialized care, specialized treatment by specialists who work in this. Now, we've talked a little bit about what we're looking for, like what's the criteria, but you've heard me talking about things like irritability, anger, social isolation and detachment, or reckless behavior. I think it's very easy sometimes for the outside world to say, what are you doing? What's wrong with you? Because they see the behavior first. And instead, as trauma-informed care people, it's important to kind of ask ourselves, I wonder what happened instead. To talk to people with an understanding that these things could stem from trauma, it could stem from these adverse childhood experiences. And it's interesting because some people don't connect it. Like they're having all those symptoms and all those pieces, and they don't connect it back to all these adverse childhood experiences. And so having that conversation can really be eye-opening and insightful for them as well. So we want to make sure we do people first language. There are a lot of different types of therapy, and so there's a lot of actually different types of way to heal through trauma. But for today, we're going to just talk briefly about trauma therapy. We're really looking at more evidence-based, evidence-informed kind of interventions, but just to know there are so many ways to do it in terms of finding an authentic way for you to heal through something that's quite difficult. It doesn't have to be these ways, but we're going to kind of stay in the realm of trauma and therapy modalities. The first one, which I really, really love. I love to be able to work in. I think it does such a beautiful job. And we'll see a short video in a little bit about why. But cognitive processing therapy, it really looks at that view, that changing perspective of self, other, and world, and really helps identify maybe why that shifted and how it shifted. Then you have eye movement desensitization and reprocessing, EMDR. We normally call it that. It's a long phrase, but it does look at the different ways that things like bits of memory are stored in different places and how to bring those back together. Prolonged exposure therapy, and that's something else I'm trained in, and it is incredibly difficult for the person to do. It's very helpful for them. It is a profound healing process, but I always stand in awe of people who go through that process because it is very vulnerable and painful for them to get to the other side to heal from it, but they do. Internal family systems therapy, group trauma therapy, which has seemed to be very beneficial for people who are experiencing things within a collective. So military PTSD can be very benefited by group trauma therapy. Psychodynamic therapy, trauma-focused cognitive behavioral therapy, and then cognitive behavioral therapy. So this is just a tiny snippet of the different types of modalities that are available, but things to think about, because that means that if that's something that you're experiencing or loved one that's experiencing, there's a lot of different ways to find a good fit for them to see if it could help them move through. But we'll spend just a moment watching this video on cognitive processing therapy. Maybe I'm a little biased on this one.
A traumatic event can change the way you think about yourself and the world. You might think you're to blame for what happened or believe you don't deserve to be happy. You may start to believe the world is unsafe. Doing things like going to a grocery store or restaurant may seem too dangerous. These kinds of thoughts are common in people with post-traumatic stress disorder or PTSD. They're called stuck points. They keep you stuck in your PTSD and cause you to miss out on the people, places, or activities you used to enjoy. So how do you get unstuck? Cognitive processing therapy, or CPT, is a PTSD treatment that can help you break the negative thinking that's holding you back. It's based on the idea that our thoughts affect how we feel and how we act. In CPT, you and your therapist will talk about how your negative thoughts about the trauma, those stuck points, have changed you, how safe and in control you feel, how much you trust yourself and others, and even your sense of self-worth. You'll practice a strategy to change or challenge your stuck points. PTSD can make you jump to negative conclusions, but there may be other ways to think about things that are more accurate and less upsetting. Imagine you're driving down the highway and someone swerves in front of you. You might blow up at the driver. What a jerk. But what if he was racing to the hospital or having a panic attack and rushing to get off the road? If you considered these possibilities, you might not feel as angry. The bottom line, small changes in thinking can have a big impact on how you feel. Some people find that writing about their trauma helps them change upsetting thoughts and feelings. You and your therapist can decide whether or not this is right for you. CPT works just as well either way. You can also choose to meet with your therapist one-on-one or in a group with others who have PTSD. CPT is evidence-based, meaning it's been shown to work in multiple research studies. And it doesn't take years. In fact, CPT usually takes about 3 months of weekly visits. CPT can help you get unstuck, freeing you up to start enjoying the things you've been missing out on. Men and women, veterans and civilians can all benefit from CPT. If cognitive processing therapy sounds like it could be right for you, talk to your doctor about finding a CPT provider, or visit the National Center for PTSD website at www.ptsd.va.gov to learn more about CPT and other PTSD treatments. No matter how long you've been living with PTSD, know that you can get better.
That's a great takeaway, that no matter how long you've lived with trauma or its impacts, or with post-traumatic stress disorder and not found the right fit for you in terms of treatment, there can always be a search for something that is a better fit. So we are going to take a little bit of a coping skills break, and we're going to talk about radical acceptance. Again, one of my top favorite skills to learn, but really one of the hardest ones to put into practice. If you're familiar with the Serenity Prayer, that's an example of radical acceptance. If you've heard people say it is what it is, not flippantly, like it is what it is, but really it is what it is a form of radical acceptance. So what does this look like? It looks like you recognizing in a situation or a relationship what part is within your control and what part is outside of your control. And most of the time, the things that are within our control are just us. And everything outside of our control is other people, is situations, or things that are really large scale. We can't control those, so we let them go. It's accepting reality. It's moving away from things like that's not fair, that shouldn't happen. Because while that may be how you feel, it doesn't shift and change that is what it is. I don't have to agree or like it. I don't have to say, oh, that's great, I like this situation. I can say I dislike it, but it is happening. And when we talk about that in the terms of trauma, if someone has experienced trauma, denial and avoidance isn't going to change the fact that the trauma happened. Radical acceptance would say, accept that it happened, accept that it impacted you in some way. Now, what do we do moving forward? Because that's in your control. It does require practice, because we wake up and sometimes it's hard to do that. It's hard to kind of hold that, be accountable, and be honest with ourselves about something that's not hard, that difficult. But it's also possible to use this as an alternative to forgiveness. I don't have to forgive someone who has harmed me. Instead, I can say, I was harmed. And that's going to be over there, the rest of that. But for me, I was harmed. And so now I'm going to take care of myself. I'm just going to radically accept that it happened and figure out what I need to do moving forward. So again, a difficult practice, but one that can be incredibly helpful, especially if people are moving through recovery with trauma. Venn diagrams, I know. This one looks like a stack of bubbles, but the reason I think it's important to talk about the definitions is because we're moving into talking about vicarious trauma. And there's a lot of interchangeable definitions for this, and you can kind of see why it can definitely have some overlap. So let's try to pull them apart and make them just a little bit more distinct for ourselves. So burnout. Burnout is really centered around the workplace, and it's about stress and frustration related to the workplace. Compassion fatigue. Again, that I'm tired. I feel emotional and physical fatigue. This is often stuff that providers, especially if they're working with individuals who have trauma, will say, like, I feel really exhausted. And they struggle to renew, to rest, and rejuvenate. Despite best efforts, they will still wake up with that exhaustion. And this can actually start to impact empathy. We sometimes resent what we're willing to give when at the end of it, we feel so exhausted. And we'll talk a little bit about how to maintain compassion towards the end of our presentation. We've talked about post-traumatic stress disorder and the big factors like avoidance, experiencing, and numbing. And then there's secondary traumatic stress. So this is where I'm being exposed to that indirect trauma. People are telling me stories, telling me what's been happening. And I'm starting to picture that. I'm starting to take those stories home with me. And I'm feeling fatigue and I'm feeling anxious. And when that feeling starts to transform how I see the world and other people and myself, when I'm emotionally engaging in a story that is someone else's story, then I am now having vicarious trauma. Vicarious trauma is one of those big things that can impact our healers because they're human. And we talk about boundaries and how important they are. But boundaries that look like this means I don't have a lot of empathy. That's too bad for you, but I'm okay. And then we have this. That's too much of a crossover. Your story is my story, and so I take it home. What we want is empathy. I know that you're suffering, and because I'm human, I feel that too. And I'm motivated to help because of that. But I can still disengage and go home. This is a really unique one that happens to our healers. It changes how we see the world and other people. It changes how we feel sometimes, those big emotional changes. And then it starts to make things hard, like doing our day-to-day, staying connected to the people that we love and care about, and just being able to get things done. When we talk about this, we're looking for some really specific things. Are you starting to struggle with talking about how you feel? Are you having anger or irritation? Are you starting to have that startle effect as well? Sleeping and eating issues. Are you worrying about doing enough? That's a big one for our providers, especially those who work with people who've had trauma. Am I doing enough? Can I do more? Are you starting to dream about it? The traumatic experiences. Again, are you trying to do things that are fun, but it doesn't feel like fun? Are you having intrusive thoughts? And the way I like to discuss this with people is it sounds like it is intruder. I'm trying to wash dishes and I'm thinking about my garden and the trauma, the thing that was shared with me, the thing that I experienced. I'm not trying to purposely pull it up, but it intrudes into my thoughts without me wanting to. Is that happening? Do I have low self-image or self-regard? Am I losing my trust? Am I feeling hopeless and helpless? Those are two big ones to look at. Hopeless means it's never going to get better, and helpless means there's nothing I can do to make things get better. Are you struggling with self-care in some of your relationships? So these are all kind of those beginner signs for vicarious trauma. And if it's something that you're starting to experience, to really think about reaching out and getting some support, because it's very hard to hold this perfectly steady with everything that's happening around us or inside of our worlds, because we can feel unwell, we can feel overwhelmed, and that starts to make that perfect balance really difficult to maintain. Doing the work before you need the work is really helpful. If you already think, I kind of am struggling, but I don't have this in place, it's a great time to work on it. But if you're excelling and you're thriving, it's the best time to work on skills, on self-care, and on improving mental health literacy because you have the resources available. One of the things I love to talk about is support plans. So you're going to figure out, who do you talk to that helps you feel better? You don't talk to them about what's happening. It's just fun. They're fun. They are going to lighten your emotional load. And who do you talk to who's non-judgmental, who gives good, unbiased advice? And so that's what you're going to call about what actually is happening, your stress. Providers, make sure you have your providers' numbers saved in your phone. And because self-care could be something that slips out, if you haven't seen a particular provider in a while, reach out to them to make sure they're still active and they're not retiring anytime soon. It gets really complicated, and that happens here uniquely in Hawaii. That so many people are retiring or moving to the continent. So making sure you're reaching out, making sure you know kind of that they're there and that you're kind of plugging back in because we want to get that protective support, especially if you were watching the ACEs video and you thought, that's me, I'm 6 and above. How we start to provide more support around that so it doesn't have to be predictable is to make sure that you are taking good care of yourself with getting those labs done. You're reaching out and making sure your providers can talk to each other. That's a really simple thing to be able to go in the office and say, I have a provider, let me sign a form so you can talk to each other so I know my medication is safe and consistent. If you happen to be a provider, there are therapists for therapists, psychologists for psychologists, psychiatrists for psychiatrists. So why is that important? For some people, it can feel that there's stigma related to being a mental health provider on some level and saying, I'm not okay, and saying my boundaries have moved and I'm burning out or I'm having vicarious trauma. There can be stigma related to that because you feel like you're on the same page as the peers in the community that you're going to go talk to about what's happening. But instead, what could be helpful is to find a therapist for therapists or a psychologist for a psychologist who's been in the field longer, who works specifically with people who are providing that type of care, and they are very well informed as to the unique issues that can come along with that. Things to consider. Make sure you have your crisis resources saved in your phone. Hopefully you never need them, but if you do, you already have them. And then what I like to call is the fast five. Sitting where you're sitting right now, looking around, do you honestly have 5 self-care items that you can access in the next minute or two that can be helpful for you if you are feeling overwhelmed? If the answer is no, that's a really good place to start. Think about your home, think about your office, think about your car, think about the bags you carry, that you have items accessible to you at any point in the day, but you don't have to find them, just have them. And I think that's a really great thing to put into place because then I can just grab and go. And they don't have to be serious. Like I don't have to be like, let me go get this particularly like sensory item. Like it could just be like a little squeeze stuffy. It's just fun to squeeze it out of people's eyesight. I have a lot of different things that I keep around me because sometimes we do encounter things unexpectedly that works for us. I've had people that I worked with who had the little poppers, things that you pack with, and they would just cut them out in squares and stick them in their bags. And then when someone was stressed, they'd actually hand them out, like, here you go, just pop some of these. And it was just a really great way for them to be able to take some time out and ground. Also asking yourself what gives your life meaning. It shifts and changes, and that's okay. But as long as you know what you're working towards, it can be really helpful. I think resiliency is something we talk about a lot, but it does get a bit of a bad rap on occasion. Because when we talk about resiliency, it's not that something is easy, it's that something is hard and challenging. And despite it being hard and challenging, we face it and we ask ourselves, what do I need to move through it, to overcome it, to get strong enough to move past it? And there's a couple of things that we found that work. Connections, relationships, join a group, engage with people. I have a group that I meet with twice a month, and we do Spaghetti with Kabata, which is Japanese floral arrangement. They are non-connected to the rest of my community and my support group. And I love being able to find a different way to express how I feel and what's going on and connecting with people from so many different walks of life. So sometimes joining a group gives you a really unique new perspective that you were missing before. Foster wellness, take care of your body, take care of your mind, but try to shift away from negative coping. Again, find that meaning. Sometimes for some people, it's helping others. but never to the point where we also feel resentful. So really find that good balance and try to focus on growth. Sometimes I think we focus on the hustle, on the growth, on the positive vibes only. And I'm actually one of those people who like, I really believe in embracing shadow. I really believe in not assigning kind of judgment to different parts of my life where maybe I make decisions I wouldn't make now because those parts got me to this part. And so they did their job. I might not like how they did it, but they did it. So being really careful about how we look at growth and how we look at those challenges, how we kind of have healthy thoughts and shift our perspectives, and we learn from our past. We don't have to stay in negative places with our past. You heard me talk a little bit about compassion fatigue. And I think we're having a lot of that actually more than we've been talking about in general. Because what compassion really is this idea that as human beings, we have to recognize that we all suffer. That's just the nature of being humans. At some point, we are going to suffer. And that's also what connects us. And because someone else is suffering, I'll see that and know that I too have suffered. And that makes me feel connected to them. I feel for them. But that feeling of discomfort is normal. If I see you suffering, that makes me hurt, and then I want to be motivated to help you. But what happens when it does the opposite? It makes me want to avoid you. You can see that's where sometimes compassion becomes difficult for people. I have to be able to tolerate that discomfort. And so sometimes when people don't show up for us, it's more about their inability to tolerate it than ours in sharing it. But we focus on tolerating it and motivating the shift and change it. Now, compassion fatigue is something we're talking more about. And I was like, let me just do some research and let me study this and figure out how do we maintain compassion with it? Everything that's going on, all the differences, all the things that are happening. How do we maintain compassion for each other? I don't know why I thought it would be so quite complicated, but of course it's that we take care of ourselves. They actually found in this big meta-analytic study and in all the meta-analytic studies that self-care is seen as central. The capacity to maintain care for others. I cannot give what I do not have. Self-care, self-compassion breeds an environment to care about other people as well. So things to think about why we talk about self-care, why we promote it so much, is that if I take care of myself, I can then, when I'm ready, take care of other people too. So what is some of that self-care? The first thing I'll say is learn to say no. Learn to take things off of your plate. Self-care doesn't have to be adding things on. It should really be about, if you're feeling overwhelmed, prioritizing and setting boundaries. I can't do that right now. I don't have it to give. My bank account is empty. However you term it, to feel okay with saying that, because we don't have it all the time to give. We're not always at excelling, and that's okay. So you hear people say it's okay not to be okay, but it's really, I think, hard sometimes to embrace that and believe that. We want to make sure we're staying present and not moving too far back in the past and staying in that place where we can't do much about it. Doing that mindfulness, again, there's that radical acceptance and validating how you feel. It's okay to feel whatever you feel, even if it's complicated. So we stay connected to the people in our lives. And if at this point you're thinking, I think my support system needs a little bit more in it, to start to be very intentional about how you expand that, because not everyone's going to be able to be available all the time. A really big one is take time to laugh. How long has it been since you had just a deep, guttural belly laugh, like tears flowing, like I can't crying laugh? Like that's such a healing thing just to have and to find in your day to day. Having creature comforts. I know it seems small, but in our office, we have our office fish, the Barbies. They're in the kitchen. And then behind me, taking a nap on the floor, is my little elderly dog. And when people have a stressful time in their day, they literally come and pet him. And so I think being really mindful of what nature can do, of what spending time with just animals can do, is really nice. We're not all going to have pets. We can go spend time in a cafe. We could go to a working farm and spend time like volunteering there or at an animal shelter. But taking time to just get back to things that are very simple and that are very fulfilling for us could be beneficial. Now, I'm the first to say, follow a schedule. I kind of like to be a little bit more, maybe like a flipper each other than that. But a schedule when we're stressed really lets us schedule in self-care, really allows us to prioritize and take things off that we can just wait later for. When we don't have as much of a clear schedule, it gets harder to do that. So just something to think about if you're not one of those people that yourself who follows one all the time, but does find that the stress is getting higher, to start to put one in place and really focus on your sleep. I'm going to say this. Hawaii is normally #1 in the country for adults who do not get enough sleep. We both have the traffic award sometimes and the sleep award. So really think about how to manage some of that stress, how to focus on getting good sleep hygiene, to talk to your doctor if you're not having good sleep. I know that we sometimes just think, I'll catch up, I'll catch up. But if you've been saying that for years now, it could be something else. It could be a medical condition contributing, or it could just be a sleep condition. So it's really good to talk to your primary care physician and say, you know what, this is what my sleep looks like. And to talk about quality, not quantity. Because I think we have a tendency to go, I got 7 hours. Okay, but how long did it take you to fall asleep? When did you wake up? Was it before the alarm or half an hour after? How many times did you wake up? And how easy was it to fall back to sleep? If you were to sit in a very comfortable room that was quiet with the lights just slightly dim, would you fall asleep at 2 o'clock, at 10 a.m.? Sleep is a little bit more complicated, so just think about that if that's something you're struggling with. Use social media responsibly. It's meant to connect us, not disconnect us. And so if you're feeling overwhelmed by staying informed, take breaks. If you are finding that your community doesn't have all the resources that you need, do look online. It's possible that they have it just in a different format. And acknowledge that you are worth investing in and that it isn't selfish when you do self-care. I'm one of those people who embraces the word selfish. I'm like, yes, not everyone feels that way, but I'm like, that means I'm taking care of myself. Like I'm really working on filling up my cup so that I have something to give back. So think about where you can make some small changes in self-care. But honestly, by coming today, you've been practicing a lot of different skills. And so you can check that off as being done today. You'll hear me talk about things like skills quite frequently, but really the idea here is when you are in a better place on that spectrum, to find time to build your mental health and literacy and resiliency. And I always say on a personal note, grief literacy is critical. So if you have time to do work there, do that as well. It's good to have knowledge and information about skills, about self-care, for things that you might not have to face yet, but you have them when you need them. Make sure that your lifestyle is manageable and sustainable. I love gardening. I had a massive garden when I was working from home. It is no longer manageable or sustainable, and I had to decide very intentionally what I would keep and let go of. And I think we have to all look at our lives like that, is to ask ourselves, is what I've selected for myself manageable and sustainable? Does it grow positive mental health for myself? Or do I need to just trim it back a little bit so that that feels better and that feels less stressful? Again, making sure that we are aware of any resources that we might need. I don't want to oversimplify things because this is kind of a broad view of post-traumatic stress disorder and trauma. And so I don't want to do that when we talk about self-care either, because what we know is that these are big, sometimes systemic issues. And so self-care alone can't be the medicine for that. What we need instead is an understanding that there are policies and procedures in place that make sure that there are effective intervention for the people who need it, that there are accessibility for treatment, because just because something exists doesn't mean that it's accessible for everyone, for all people. So really think about where you work, that you're very clear on the policies and procedures, how it supports maybe yourself or your coworkers if you're having some of these struggles like vicarious trauma, to make sure you know what it would be that you would need to do next steps. If you're saying, yes, I do think that's something that's happening for our team, that you have a discussion with supervisors, that the admin is kind of familiar with how do we provide support for our feelers so they can keep feeling. If these aren't conversations that you've had, this is a great time to start it, right? To really think about effective intervention. If you have an underutilized EAP, as a lot of people, to really start to figure out how do we normalize accessing that? How do we remove obstacles to people who are comfortable accessing that? what treatments are really available in our community and how can we start bridging the gaps of care. So again, self-care is fantastic. We want to make sure that we do that, but that is really not going to fix everything. And so having advocates, having these bigger conversations about policy is important as well. I come from Mental Health America of Hawaii, and we do have some resources I want to point out. We have a lot of different social media. Most of the time I give this presentation or presentations with students, and they giggle because I say Facebook. But yes, we do still have Facebook, Instagram, TikTok, and X, but I always want to highlight YouTube. If you want to learn more about sleep, if you want to practice things like autogenic training or diaphragmatic breathing, our YouTube has all those trainings there. They're free, they're shareable. We want to make sure that resources and tools are accessible to the community. And our big thing is de-siloing mental health skills so everyone has them when they need them. We'll make sure you get a PDF of our slides. And so we do have this crisis resource sheet 988, of course, is the big one we always talk about. It does link here at Hawaii to Hawaii Cares, also the crisis text line, Trevor Helpline, and then our online screening, which is anonymous and available at any time if you're wanting to check on things like anxiety, depression, or anything related to that. And we'll give you kind of where you fall on the spectrum and recommendations in COVID Coach. Of course, Veterans Crisis Line and unique to us here in Hawaii is the Hawaii Poison Hotline. So make sure that you save those in case you need them in the future. We also have our NoShameGetHelp.org. You heard me talking about those different kind of numbers, how to create a safety plan. And this is one place you can go to that has all of that. So it gives you your crisis numbers, you can create your support plan here. It talks about helping yourself or helping someone else, and it also links to those screeners, which can be helpful. Again, we'll make sure the slides are available, but there's a bit.ly to the screenings. If you have any questions, please feel free to email us at info@mentalhealthhawaii.org. We do have an Oahu office and a Maui County office, so you can call us. We don't have direct services, but we do connect people to different services that we're providing help directory. And that QR code is actually feedback. So we look at that all the time and ask our community, what do you need? What is something that isn't being talked about and shared? How can we provide care and support in that way? And that is how we create our new trainings that we give to everyone. And we're very lucky because we provide them at no cost at all. So if that is something you want to give us feedback on, please let us know what's helpful or what you would like to see. But I want to spend just a few minutes answering any questions or comments that came up today.
So we had a few questions in the chat that I collected, but if people still have questions, please feel free to leave them in the chat. Let's see. In the ACE study, did they also talk about having multiple deaths in the family and how that affects individuals?
Not that I'm aware of. Now, there might be kind of like an in-depth expansion study that was done around that in terms of multiple losses. But I do know, I'm just going to say this out of someone who's done work and research into grief, is there's not enough studies. It's one of those kind of ongoing issues of people are very uncomfortable talking about grief, and yet so many of us are experiencing it, and how we experiencing it, at what age we experience it, whether it's pre-verbal, different times of our life, and who it is in a relationship to it can really shift and change your experience of it as well. So there's quite a bit of research done in that in terms of when you get into the specifics and you're able to kind of track that down, but not enough, vastly not enough.
Thank you. How can we help those who, after years, have not been able to reach recovery, specifically those who continually try to escape even though they are not able to? What options are available for them?
I think, and this is going to be, I don't want this to sound rainbowy, like a blue washover, but hope. I worked with people who had traumas in their teenage years, and I was working with them and they were 70. That was when they were ready to do the work. That's when they were able to get enough resources to do the work. They came into see me at that point. And I remember doing that work. It just like inside of myself wishing that the accessibility had been there before then, the readiness had been there before then, but it was very limited resources in that community, very limited understanding of the impacts of those types of traumas, and a lot of stigma around talking about what was happening and the things that were impacting people then. But I just remember that one client saying, everyone you meet who struggles with that that idea of I waited too long to let them know there's always hope, that it can always move into recovery, it can always get better. That is what we focus on. So I think that we just keep planting the seed. We keep saying these are the things that are available. And unfortunately, sometimes people go out and they get help, they get a treatment, and it's not a good fit. And so I always say, it's like buying a pair of shoes. Just because it's your size doesn't mean it should fit. And to think about that and to allow yourself to say, it wasn't mine. And can we talk about why it wasn't and what you would recommend instead? Right? Because it should come from a place of non-judgment, and that in some ways you're the expert of your own healing. And so this isn't working for me, can we shift and change, but also being open that I might have to learn new ways of healing to be able to keep moving forward.
Thank you. That was a really, really insightful answer. Appreciate that. Can you speak onto this question? Can DBT help with trauma?
So dialectical behavioral therapy, you might have noticed that you brought that up. You might have noticed that some of the things I was talking about in terms of critical crisis skills, actually I de-siloed out of some of the dialectical behavioral therapy modality. That is a fantastic, fantastic therapy modality. And the reason why is that people who grow up in abusive homes will really struggle with things like emotional regulation, how to manage how they feel. And what dialectical behavioral therapy does is it embraces that. It kind of creates a place of non-judgment to be able to grow through that. It allows people to learn skills to feel more empowered from a situation that was very disempowering. And so I know that most of the times when people talk about it, it's related to borderline personality disorder, but I honestly think there are so many amazing things that come out of that particular model that we would all benefit from having skills de-siloed. And we actually, when I worked in patient care, taught dialectical behavioral therapy alongside some of the other ones we talked about, like cognitive processing therapy. 100% it can be beneficial.
Great, thank you. Next question. Could you talk about the name of the Japanese practice mentioned? I believe your sound cut out for that part.
Oh, Sugetsu Ikebana. Yes, so it is, Ikebana is the Japanese art form of flower arrangement. And the reason I think that it really spoke to me, especially the Sugetsu, which is, this is a centuries old art form, but Sugetsu is more of the 1920s. It's the rebel renegade version, so I can use whatever materials I like. But I think what it taught me so much is how to express myself in a different way, in a different form, but also how to understand that when it's such a beautiful philosophy that you can see something in nature that is so perfect, and that once you've removed it from that place, it will never be as perfect as it was in that moment. And so you have to create something new. And that taught me about the importance of change and adaptability in life. And I think that's probably why I'm still really enjoying it. Like, what am I going to make new out of this thing that was so beautiful to begin with, that is unique and kind of a different perspective? So I'm always advocating. Ikebana is great.
Great, thank you. Appreciate that. Do you have any recommendations about reducing stigma around PTSD and trauma?
I think when we start to share the statistics around trauma, when we start to understand its interplay with things like medical issues, with things like what occurs in childhood and how rampant it is. That 70% of us will have some type of trauma in our lifetime means the majority of us are having these experiences. Now, very small group will not recover, but that means we all have that universality understanding, or quite a few of us do, of what it means to hurt like that. And so when we start to kind of bring that data out into the forefront, and instead of talking about this behavioral issue or well, we should do this in more punitive, but instead to understand even things like when we do jail diversion studies and find how many people in the last 12 months have experienced trauma, it is over half. It is like 70-80%. How many people have had it in a lifetime? 80-90%. So to start to understand, it is something that rolls downhill and picks up speed if we don't provide support. It is something that is, when you really narrow it down to it's one hurting and trying to figure out ways to not do that, and they're not always positive ways. So being a trauma-informed state, really normalizing that people have these experiences and that they don't all choose a route that is comfortable for us, that is sometimes difficult for us to talk about and difficult for us to be around and to find specialists who are going to kind of make it more aware in the public health arena is incredibly important.
Thank you. Let's see. The dive response and slash or temperature regulation both can be achieved with an ice bath. Is it common for one to use multiple practices to enhance response?
Ah, I love it. So I am one of those people, if you give me something and I can do three of it in 5 minutes, done, I'm doing it. So when I was teaching this, I did it with inpatient adolescents, and we would take washcloths and we would dip them in cold water, roll them up, put them in the refrigerator. But what we added was a drop of lavender oil. So we got aromatherapy, dive response, and they would do diaphragmatic breathing while they did their dive response. And that was to breathe in 5 minutes to calm their nervous systems. And these were teenagers who didn't have that kind of emotional intelligence, exercise building, and modeling available to them. And they loved it. We could not keep them in stock. Sometimes I'd be like with my staff, like, do you have that on your face? Because it is really relaxing. So if you can find ways to meaningfully combine them, self-care doesn't have to be an hour. It doesn't have to be more than 5 to 10 minutes. It's most effective when it's 5 to 10 minutes. Absolutely do that for sure.
Thank you. If there are any more questions, please keep asking them. I know that there were a few questions about receiving slides. You will be receiving the slides in our Mahalo emails today. I will be sending them out by 5 o'clock Hawaii time. I know we have some folks on different coasts, so I'm not really sure what time zones to convert it to, but just to be in mind, it would be 5 o'clock Hawaii time. You should expect it by. And this training is going to be recorded and posted onto YouTube later. Okay. I don't see any other questions, so I just want to close this out. I want to extend a big mahalo to you, Miss Disa, for being our trainer today. Um, to receive continuing education credit for today's webinar, please complete the evaluation form that will be emailed to you. That must be completed by the end of business day on June 18th, but that is next week, Wednesday. After you complete your evaluation, certificates will be emailed to you by the end of business day on July 1st. If you have not received your certificate by then, please email melia@hifi.org. That is MELIA at HIPHI.org, and I can help you figure that out. We hope you can join us for another training session. Aloha and take care.